So early on, Riley Hospital did research. The first facility that we had for research was the 1949 research building. But to be a great children's hospital, or any great hospital, you gotta be doing a critical mass of research to make things better. That's how everything gets better. So we started planning for a new research facility. We wanted to name it after the Chancellor of Indiana University, Herman B Wells, who one of the best known university leaders in the country. We were very fortunate to be able to attract a good old another Southern Indiana boy, David Williams, and within 10 years, he built the Wells Center up to a top-notch program.
What the Wells Center does, both in its physical structure, but more in its people who work there, is say, for Riley, we are committed that this is an important part and we are going to push the envelope of research as much as we push clinical care. So Dr. Wade Clapp, who is our physician-in-chief for the Department of Pediatrics, has done an amazing job recruiting researchers from all over the world to come here. And they are bringing new cures, not only to Indiana, but globally.
I'm Wade Clapp. I'm the chairman of pediatrics at the IU School of Medicine and the physician-in-chief at Riley Hospital for Children. If there's going to be innovation for children, it really needs to happen in children's hospitals. 80% of research funded from the National Institute of Health, which is the largest funder of children's research in the country, happens in 20 departments in the United States. We have been in the top 10 for the past several years with the support of the Riley Children's Foundation and the School of Medicine and IU Health.
My name is Ruben Kapoor. I am the director of the Wells Center for Pediatric Research, and I've been here for 30 years. One example of something that we're very proud of has to do with a mechanism to delay the onset of type 1 diabetes in children. The clinical trial was conducted by Dr. Emily Sims, and the translational work that she and her team did resulted in the FDA approval of this drug, which has now become the drug of choice in delaying the onset of type 1 diabetes in the children. That's just one example. There are several other examples. For instance, the disease called neurofibroma or neurofibromatosis. And this is a rare disease in kids who develop nerve tumors all around their body. Huge tumors, they are disfiguring, they are painful. And Dr. Wade Clapp has been studying this disease for over 32 years now.
Through a series of studies in genetically engineered mouse models that we developed that closely recapitulate the pathogenesis of different conditions in NF1, we began to actually move things forward into the clinic. When a mother from Los Angeles cold called me and said that she had a 3-year-old child who had a slow-growing peripheral nerve sheath tumor called a plexiform neurofibroma on her throat, and that was progressively compressing her airway so that she had to sleep on pillows at night. And she had been to several other academic health centers, and there were no therapies. And the only approach was to surgically excise it. And it was considered to be too risky to excise. And actually, we had just finished the preclinical studies in genetically engineered mice that showed that we could shrink these tumors. To be able to leverage that work for children's clinical trials has just been transformative. She came here and her tumor shrunk about 70% in a few months. So she was the first person in the world to ever be successfully treated. She started college this year. We've subsequently went on and did a phase 2 clinical trial. We decided to pursue the development of this SPORE grant, which is an acronym for a scientific program of research excellence. That SPORE grant has contributed to the first ever successful treatment of leukemia that occurs in a subset of these patients in babies and young children, where there was a 100% mortality before. And we know that it is causing a reduction in the need for surgeries that carry major morbidities. We're one of the premier places in the United States to go. We are at the early stages of tremendous innovation. The capabilities to better understand the molecular basis of disease is just outstanding.
IU and IU Health have a massive biobank of samples from patients all over the world that help us understand disease and genetic sequencing and precision genomics. The Wells Center has elevated not just Riley, but the discipline of the practice of pediatric medicine all over the world, and that's something to be very proud of. And we want to be that champion for children no matter where they are, and research makes that possible.
If you want to be a top-notch children's hospital and attract the very best people you can attract, you got to be doing cutting-edge research, and fortunately, that's all happening.